When you look at a leg wound, there's a few things that you need to think about. First of all, the location of the wound, the size of the wound, the depth of the wound, and how much tissue damage there is associated with it. If it's a very small scrape, in most cases, you can deal with that yourself. Anything further than that should have veterinary attention. Especially if the wound is over a joint, you definitely need veterinary attention. One of the most important things you have to remember when you're dealing with a leg wound is if you're not sure that that leg wound can be sutured or not, don't put anything on it. And if you do that with a leg wound and the veterinarian comes out, you have made it so that he probably cannot suture the wound. So if you're not sure, the better to err on the side of caution. In my experience, I've seen a lot of bad bandages, and basically when you're bandaging a leg wound, there are several components you need to think about. First of all is the first layer, also known as the contact layer, and that's the layer that you use to put dressing or ointment directly onto a wound. So it's usually a piece of talfa pad or a piece of gauze that goes directly on the wound with some kind of dressing or something on it. And then the next layer is a layer that's just a gauze wrap to keep that contact layer in place. And then probably one of the most important things, and one of the things that a lot of people don't do, is the absorbent layer, which should be a fairly thick either quilt or gamgee tissue or even a towel or even a diaper, anything that offers padding and absorption properties. So you put that over top of that, and then you would put something on over top of that to keep the bandage in place. And so you're looking at a stable wrap or a tensor bandage or vet wrap or flex wrap or something like that. So one of the most important parts of bandaging is making sure that you have enough padding over the wound so that you can apply pressure with your stable wrap without causing damage to any of the structures on the leg.